What if you could start with a clean slate and reimagine how your Medicaid agency operates? With modular AI building blocks, powered by decades of payer expertise, embedded security, and proven interoperability, you can rapidly assemble intelligent workflows that fit your business. Process Orchestrator brings it all together, coordinating AI, people, and systems to rapidly transform complex operations into seamless outcomes. Now, let's see what that looks like in action. This process flow demonstrates one example. It shows how claims move through the full claims, fraud, waste and abuse, and payment integrity lifecycle. The workflow begins by uploading the desired claims file into the orchestrator. In this example, the file contains pended claims, including claim IDs, billing amounts, CPT codes, diagnosis codes, provider details, member information, and other supporting claim data. This data is first used for primary provider and member verification. It is then processed through provider management checks and fraud, waste, and abuse verification. Once the file is added, the user simply clicks Run, and the flow begins. As the process runs, the interface shows which stage is currently active, along with a preview of the results. The system also displays how many claims have passed and how many have been flagged. These flagged claims can be considered during the adjudication process, where they may be marked or routed for further review. In a similar way, the flow also includes prior authorization checks, provider management validation, and code validation. Together, these checks provide a clear view of the total number of claims that have been flagged across the pipeline. Once the pipeline is complete, users can access multiple outputs, including clean claims and flagged claims. These results can be downloaded in Excel format for review, reporting, or downstream processing. At each step, users also have the option to download both flagged and passed claims for manual validation. This supports a human-in-the-loop review process, where operational teams can inspect the results before final action is taken. The workflow then moves into the fraud, waste, and abuse, or FWA, component. Traditional fraud, waste, and abuse programs often rely on post-payment audits, manual reviews, sampling methods that identify problems only after dollars have already left the organization. Our FWA building block uses AI-driven analytics and evidence-based detection rules to evaluate every claim, benchmark findings against standards, and deliver prioritized evidence-backed cases investigators can act on immediately before money goes out the door. Because every rule is benchmarked, every alert is explainable, and every finding is supported by actual claim data, organizations can move beyond reactive audits toward proactive payment integrity. That improves recovery rates while reducing investigation effort and false positives. While FWA has multiple components, like checking for duplicates, upcoding, unbundling, medical necessity, and others, for the purposes of this video, the system looks for duplicate billing patterns, upcoding, and unbundling. Here, duplicates do not simply mean that the exact same claim appears twice. Instead, the system identifies cases where a provider may have billed the same member for the same procedure on the same day, or billed the same type of service across different dates in a suspicious pattern. These claims are marked as potential fraud and can be routed to the SIU team for further investigation or manual review. The FWA component also checks for provider-level fraud patterns, such as upcoding and unbundling. For example, a provider may bill unusually varied diagnosis or DRG codes across a small number of claims, which may indicate upcoding. Similarly, unbundling may occur when a provider splits services into multiple claims, potentially increasing reimbursement. These patterns are flagged for review so that the organization can investigate before payment decisions are finalized. After FWA checks, the claim moves into payment integrity. This step helps health plans prevent overpayments before they happen, rather than trying to recover funds later. The prepay engine reviews each claim against CMS/NCCI rules, including bundling, unit limits, add-on codes, and medically unlikely edits. It then provides a clear line-level outcome: pay, adjust, pend for review, or deny. Each decision is backed by a policy reference and a simple explanation, giving teams the transparency and confidence to act quickly. Once the primary payment integrity check is complete, the claim moves into the system of record, like Health Rules Payer, Facets, or QNext, to name a few, for final adjudication. The system also creates an audit file that captures the final output, including what was processed, what was flagged, and what actions were recommended. From there, the claim proceeds to payment processing, or SIU processing, depending on the outcome. This completes the end-to-end orchestration flow across claims processing, fraud, waste and abuse detection, payment integrity, final adjudication, audit reporting, and downstream payment or investigation workflows. What you just saw is one workflow, built from the same reusable AI building blocks. For more information, visit healthplans.ai.